Good morning. I now call the emergency meeting of the Board of Commissioners to order. I ask Susan Mabry to call the roll.
Chairman Michelle Morgan.
Here.
Vice Chairman George Chambers.
Here.
Commissioner Montrell McClendon.
Here.
Commissioner Clint Chance.
Here.
Commissioner Tommy Lee.
Here.
Commissioner Steve Fuller. Commissioner Ernie Reynolds.
Here.
Thank you.
Okay. Also joining us are the county attorneys, Stacy Blackman, Avery Jackson, and our EMA Director, Tim Pageant. I'm now going to call on the Vice Chair, Commissioner Chambers, to do our invocation.
Please pray with me. Our most kind and gracious Heavenly Father, Lord, we come to you this morning seeking your wisdom, your guidance, and your blessings, Lord, over what is taking place in our county, our state, our nation, and your world, Lord. And I just pray that the things that we say and do here, Lord, will be pleasing in thy sight and be beneficial to the citizens of this county, Lord. And I just pray for your wisdom and guidance in all things that we say and do. It's through Jesus I pray. Amen.
Amen. We'll now do the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Commissioners, thank you for being available for this emergency meeting. I do have a department head meeting at 11 o'clock, so I'm going to call for a vote before that time. I realize that there'll be lots of questions during this time and following the meeting. Please send those questions to myself and to the county attorneys, and we'll do our best to answer them in a quickly and timely manner so you can get back with your constituents and we can have correct information going out. I encourage everyone listening to follow the Department of Health and Tanner Health System's websites and their social media platforms for the most correct information. I'm now going to ask the County Attorney Avery Jackson to present 5-1, the coronavirus COVID-19 state of emergency. Avery?
Chairman and Commissioners, we have before you a order for your consideration. It's an order, proposed order of the Carroll County Board of Commissioners instituting certain social distancing requirements and to prohibit public and private gatherings of more than 10 people and for other purposes. The order generally requires three things. Number one, to the extent individuals are using shared or outdoor spaces, they must at all times, as reasonably possible, maintain social distancing of at least 6 feet from any other persons when they are outside their residence and to the greatest extent feasible. All businesses shall comply with the social distancing requirements, including but not limited to when customers are standing in line. The second item addressed by the proposed order is that all public and private gatherings of more than 10 people occurring outside a unit with certain exceptions that are set forth in the proposed order. The third item is that all bars, restaurants, or businesses who sell food or beverages for consumption on the premises or who provide entertainment on the premises shall be closed to in-person dining, consumption of alcohol, or entertainment until the expiration of the resolution. And again, there are certain exceptions provided, such as for takeaway orders. The proposal before you also has a provision allowing restaurants that are licensed to sell beer, wine, and other distilled spirits for on-premises consumption to sell those unopened containers of beer, wine, and distilled spirits for takeout consumption off premises during the term of the order. This order was passed by a order very similar to this was passed by the City of Carrollton yesterday, and also the Carroll County Board of Health passed a similar order for all of Carroll County as well. The proposal before you today is to allow greater law enforcement remedies to enforce the proposed order if necessary. There are many cities and states across the nation that have instituted similar orders as this one. in Georgia, there are a number of cities and counties that have also begun instituting similar orders as this to varying degrees, some as extensive as ordering all citizens to shelter in place, some a lot more similar to this that's much less restrictive than that. But certain counties and cities that have instituted those are Muskogee County, Athens-Clarke County, the city of Brookhaven, and Dougherty County. And my understanding is that the city of Carrollton adopted Athens-Clarke County and the city of Brookhaven in constructing this proposed order.
Okay, I'd now like to ask for a motion and a second so we can begin the questions and the discussion.
Motion made, Commissioner McClendon.
Do I have a second?
Second.
Okay, I have a second by Commissioner Chambers. I would like to make a note that I have been in contact with all the mayors in the county, and all of them have agreed with this ordinance. Some of them may be adopting it after we do ours, but they all are in agreement with this at this moment. I'll open it now for anyone to have any questions or further discussion.
I just have a question. This is Ernie, so that I can understand technically, I guess, if the Board of Health is in charge of the county's health policy, especially regarding this unique critical time, why does Carrollton or each city and then us as the county have to adopt separate and distinct resolutions? Why can't we simply fall under what the Board of Health has done, or simply adopt in its entirety the Board of Health resolution, not draft a different one? That's what I technically don't understand. I'm certainly for this, but I just don't understand everybody doing their own thing and where the Board of Health is superseding or actually coming up with the policy.
Sure. Commissioner Reynolds, the Board of Health does have the authority to institute the order in all of Carroll County. The Board of Health does not have an enforcement arm or its own enforcement mechanisms, although violations of its orders can be misdemeanors. That's why you have some of the cities instituting their own, like the city of Carrollton, that is exactly identical to the Board of Health, but it allows their law enforcement officers greater authority to enforce that. The same in the county would allow the sheriff's department, a lot more remedies for law enforcement to enforce it, because the Board of Commissioners has an entire code of ordinances and enforces its ordinances on a regular basis, whereas the Department of Health does not have its own investigators or staff to enforce, go out and enforce all of its ordinances, such as this one that has county-wide effect. But
Okay.
certainly the board could adopt the Board of Health's order in whole, and that's kind of what we tried to do in this case. We just took the Board of Health's order that they passed and made it essentially identical for the Board of Commissioners.
Okay. I just, good. So the enforcement arm or protocol is the only thing different, I guess, than from your explanation, Avery. Because what we got in an email just said it's almost identical, but we didn't get any, delineation of like line by line what is different. So I was a little confused as to why it has to be any different. But so all the differences would be due to just the law enforcement issue.
Well, actually, the only differences in the actual proposed order are basically substituting the Board of Health for Carroll County, the Board of Commissioners, or the chairman of the Board of Commissioners throughout the order. One specific difference that I want you all to be aware of that is identical to the city of Carrollton's, but it's different than the Board of Health, is the Board of Health cannot change the beer, wine, and distilled spirit rules and regulations. And in the city of Carrollton, when they adopted this order, they allowed those licensed establishments that sell beer, wine, and distilled spirit for on-premises consumptions to sell unopened containers of those for takeaway purposes. And that is in the proposal that's before you today. Again, that was not in the Board of Health's proposal because they don't typically regulate beer, wine, and distilled spirits.
And Avery, let's
Okay.
make clarification. This is for someone, a business in Carroll County that already has a license. It's not an opportunity for someone to start doing something.
That's correct.
Yeah,
And
yeah.
the concern was that there are a number of restaurants that have a large inventory and that they could sell that inventory to get them through this time. And the city wanted to allow them to do that.
Yeah, good. I did have another question. Speaking of that, as far as benefiting the businesses or restaurants or retail establishments, as well as many agricultural business and so forth, at this time, is there anything that we can do or propose to like push back or waive or entirely delete or any particular fees or taxes or anything on these establishments during this time that would help them out monetarily during this time?
We could certainly look at, in an emergency like this, I know all options are on the table, and we certainly want to help, all the businesses in the community. And so to the extent feasible, we can certainly look at that and see what we can do or what we can't do. I'm happy to look at those issues with the Community Development Department and see what we can get back to you.
Good. Yeah, I just think it's such a difficult financial time for businesses in general that as much as we can, to the extent that we're financially able as a county, my suggestion would be to waive or delete or at least to postpone as many fees and taxes as we can.
Madam Chairman, I'd like to interrupt here if I could. I apologize for being late, but I didn't receive any instructions as to how to get to this thing. I had to call the commission office to get the instructions. So I'm online now.
Okay, good. Welcome, Steve.
Thank you.
I do have one more issue, if I can ask this. This is beyond the resolution itself, but as far as the location where several, I guess 11 of the 14 persons that were found infected just recently, in Carroll County's video, the city of Carrollton's video, they indicated this, but indicated there wasn't any disclosure of that location or site. I am for, unless there's some prohibition of it. People have contacted me and asked about where was this, because we could have been there. We need to know. I just think it's important for the public. I'm not asking for any people's identity in violation of federal HIPAA requirements, but I am asking that location be disclosed so that the people who were there can know, as well as the public can know and determine then if they were there and should do something. I guess keeping it under wraps, I just don't understand why the public can't know where 11 people were supposedly infected.
Commissioner Reynolds, that question was brought up by the city mayor and the city's attorney at the Board of Health meeting that was held yesterday, and they asked those questions to the director of our public health district and the chairman of the Board of Health, and they stated the reasons during that meeting why they were not going to release that information. It's my understanding from their comments at the meeting that they are notifying all the individuals and the contacts that those individuals may have had to notify them of the issue. But again, they stated the reasons during the meeting why they were not going to disclose that information. But it's something that, if you have those concerns, I mean, we can certainly pass those along, but those concerns have already been expressed at the Board of Health meeting, and the director and the chairman decided, for the reasons they listed during the meeting, why they were not going to disclose that.
So they've identified or notified the 11 people, but beyond that, if there were 50 people at that location, the rest of the people don't know, because they don't know if it's that location or anywhere else they may have been. Is that correct?
No. In addition, the 11 people certainly know, but in addition to those 11 people, they're notifying everybody else that those people would have had contact with to let them know, so that they can self-quarantine if they need to. They can watch for symptoms and notify their healthcare provider if necessary.
And this is the same
Okay.
case if it was just an individual that finds out today when the Department of Public Health or Tanner Health System notifies it. It's the same procedures they have in place, that they'll be talking to every single person who tests positive. So the reason we're doing this is because we really want to encourage and give our public safety the opportunity to disband groups that are not meeting the 10 and under rule. I was on a conference call this morning with a doctor from Emory, and I will be posting that later this afternoon, his slide presentation. We really need to have our community needs to step up and be assured that they need to be staying at home when at all possible, and we need to not have this go any further. So by taking these actions, we're helping our law enforcement, and I hope all of us together are standing united, and the public will understand how important it is right this moment to stay at home as often as they can and to mind the distance between people when they are out.
Yeah, I agree. I just I would like to express, though, I guess, Avery, that I am concerned about keeping the identity of that location under wraps, even if we are notifying the people, because I think the public has a right to know. And I've heard from various constituents of mine that wonder the same thing and are afraid of, was I there? So unless we can identify all possible people that may have had contact with any of those 11 people, I would say I am for disclosing the location so the public can determine if they were there and if they may need to do something else. That's my only point.
Okay.
I'm in agreement with you, Ernie. If Mike Pence can tell about his people, I don't know why the city of Carrollton can't reveal that information.
And I want
Good.
to.
Yeah.
Mike Pence told about himself. That's the difference.
But we're not violating HIPAA here. I mean, I'm not for disclosing names. I'm for disclosing the identity of the location so that people who
That's
were
right.
there might determine if they should be concerned for their own public health and safety. And I don't understand why we're keeping that under wraps. I don't understand the legality if that's the point of keeping that under wraps. I don't get it.
Yeah, let me clarify. It's not the city of Carrollton. Let's clarify that it's the Department of Health that is responsible, not the city of Carrollton. So let's please keep our facts straight. And Avery, I think you wanted to say something.
I was just going to say that same thing, that it is the Department of Public Health and it's not the city. The city actually made those questions that both you, Commissioner Lee, and Commissioner Reynolds have. They were asking those questions to the Director of Public Health and the Chairman of the Board of Health, yesterday during that meeting, because they had, shared similar concerns, and I think a lot of their constituents shared similar concerns. But that's the decision that the Department of Public Health has made.
So we will
Well,
be sure,
then-
I serve on the Board of Health, I'll be sure to let them know that these concerns were mentioned during the meeting today. Do we have any other questions?
Yeah, I do. I have a couple of questions.
Okay, who, would you please let us know who you are?
This is Steve.
Okay, thanks, Steve.
Steve Fuller, District 4. Avery, it's my understanding from what I've just heard you say that everyone that was at this meeting has been notified that there was COVID-19. There were carriers of COVID-19 at this meeting, and they've contacted everyone that was there that they've been exposed.
And I want to be very clear, I don't know that there was one meeting or something like that took place. Again, all the facts and the knowledge is in the hands of the Department of Public Health. And my understanding from them and from what they've said during the call yesterday is that that's their job, is to trace those contacts and then notify the folks that have potential risk or exposure.
Okay. Well, we need to do something to quell rumors that are starting to get around the county. I don't look at Facebook. All right, I don't look at Facebook. I really don't even know how to get people. If I need to look at something on Facebook, I have to get my son to show me how to operate it. But yesterday it was brought to my attention. He brought it to my attention. He said, "I want you to look at some of this." And I was reading down through there. And they're starting to refer to this group as a rogue church. Now, I don't know who it was. I have no idea, but that's what's out there on Facebook. They're calling this group, where this came from, a rogue church. So we need to get some information out. We need to get rid of these rumors. We need to put something out. And I don't know if we need to tell where it came from, but we need to get some information out there to stop this stuff going around like that. That's not good either.
And does the Board of Public Health operate with such autonomy that they cannot be forced to disclose this to the public? I mean,
I'm not asking that they disclose where this came from, but they need to put out some sort of a statement. They need to word it carefully, because that's what's out there on Facebook and that's what's out there on the internet.
Yep.
Well, leaves a lot of questions.
I think we'll be.
Leaves a lot of questions the way it was presented. A lot of people are wondering where and what. Concerned who these people have been in contact with that tested positive after they left the venue. Who did they get in contact with, or who have they been around? I bet they haven't been contacted.
All very good concerns, and again, we'll pass along those to the Director of Public Health to let them know that we have very strong concerns from the commissioners and from the constituents in Carroll County about that.
Okay, thank you. And I guess, are we open for general questions on this resolution?
Yes.
Okay, and I talked to Stacy about this earlier this morning about a time frame. On page 3, under where it says it starts out there for it to be ordered, we declare an emergency within Carroll County, and such emergency shall continue until the conditions requiring this declaration are abated and this order is rescinded. Okay, she told me that the way the charter and I think some other laws, we have to look at this again in 30 days anyway. Do we need to put that in the resolution, or just leave it like this and go by the 30 days that are required?
I think
go ahead.
I was going to say, I think the resolution is fine as drafted, but to the extent that anybody wanted to put a time frame in there, they could. Again, this models the Board of Health's ordinance, which is already in place, and it states those exact words, so we were just modeling after that.
Okay, but do we have to readdress, is Stacy in the room?
She is on the call, I believe.
Okay, well, anyway, I talked to her this morning, and she said that it has to be looked at again in 30 days anyway. I guess it's some state statute or something.
I think, are we confusing the original state of local emergency that does have to be looked at in 30 days? This is a different
Okay.
ordinance, and yes, as you read further down, I can call another meeting and the Board of Commissioners can rescind this order, or I myself can rescind this order at such time. It does not need to stay in effect any longer than it is necessarily needed. So it can happen quickly by my rescinding it, or there again, I can call all of y'all together for a quick meeting and we can rescind it.
Okay, well, I'm not worried about extending it, but I guess so, yeah. But I think, do we need to look, what I'm asking is, do we need to look, if this thing stretches out, do we need to look at this again in 30 days?
Avery?
Yeah, so for.
This is Stacy Blackman. I'm sorry, I accidentally hung up from the call, but our ordinance automatically states that it only lasts for 30 days unless extended by the chairman with the Board of Commissioners ratification. So it does not have to state that because it's that way automatically. We could change it. It's a little bit easier not to make technical changes at this point, but it's up to you.
Yeah. Okay, no, I'm happy. I just wanted to make sure that was clarified, that we did have an ordinance or something in place that we're gonna have to look at this in 30 days. That's good. I'm satisfied.
Thank you.
This is Clint. The first thing I want to say is that I have been following this very closely and been on a lot of the conference calls that's going on with EMA and the health board and different things and the chairman. And I want to thank the chairman and the staff and everybody that's been working extremely hard on this. I want to thank Tanner Health Systems, all of the other health systems, the nurses and the doctors and everyone in the healthcare profession that is on the front line of this. We want to thank them for their service and dedication and putting themselves on the line to try to serve the community. I am in total agreement with the information that I am seeing and hearing about the social distancing, that is the proper thing to do to try to contain this virus. And so some of my questions that I've got is not anything to challenge that is what needs to happen. I think some of the questions I have, though, is essentially the first thing I have is I want to go back to what Commissioner Reynolds says. There seems to be some confusion amongst some different government officials about how the policy actually works. And I understand that we still have mayors, we still have city managers, we still have chairmen, we still have people that are operating within Carroll County, and I'm not trying to disrupt that. But it's like in one way I'm hearing that the health board is in charge of the crisis, and then in another sentence I'm hearing, well, everybody's still got to go through and do this or pass exactly the language they want. And so I'm still looking for legal clarification. And Mr. Jackson, you went through some of the information as far as that the county is the one that actually has, I guess, the resources to enforce this, but I think I'm still looking more for clarification. Does the health board essentially act on behalf of the county, including the municipalities, during a pandemic? That's my first question.
The County Board of Health does not act for the mayor and city council or for the Board of Commissioners, but it does have concurrent powers and certain powers and authority related to disease and controlling infectious disease, such as the current situation we're in, and they can pass rules of general effect that affect the entire county as a whole.
Okay, but I hope you can see where I see that's kind of a slippery slope. In other words, we can have a municipality, and I understand the chairman has stated that the municipalities are on board. Here again, we can have one that wasn't, and then there becomes, is the health board truly giving us the directives or not? So to move on, not to muddy that water any further, I'll take a practicality issue in Billerica. I have been trying to stay in as much as I can to be responsible, but I've, like everyone else, I've had to have food or different things that I've had to get in the home. And so I've tried to watch, I've tried to do takeout with local restaurants following CDC guidelines. There's some of these restaurants that have outdoor seating. I have seen families of 2 or 4, sitting in an outdoor area at a restaurant, and then others would be 20 feet away. And so I worry about unintended consequences. Here again, I am not challenging that the social distancing is not what's needed. I want the community to understand I am in full support of that and listening to our professionals such as Dr. Larson. So there's no questioning about the effect of that. I guess my concern is, though, we still have been following federal and state guidelines for the most part, and the CDC guidelines are essentially stating, the 10-person or less rule, the 6 feet away rule. But the reality of my understanding of how this resolution would work is that there could not be any type of seating, even if it was outdoors and they were properly separated, if it was connected to a restaurant. Yet we're making exceptions about work, which I know work is very important, and so are the vital essentials that we need services to continue. But we're making exceptions for that. And then, I'm looking at churches. I think for the most part, everyone, whether you're a church, whether you're an individual, whether you're a regular business, a restaurant, everyone has tried their best to follow guidelines, I think, as a whole. But I look at this and I say, well, a church, they can't eat if they decided to, but at work, you technically could make an exception that someone could be within 6 feet of one another. So here again, I'm not trying to send a mixed signal. It's just this is a very big deal that we're fixing to implement essentially a law that everyone has to follow, but there's a lot of loose ends, and to me, we seem to come down a little bit harder on the restaurants. I understand they can still have takeout, but that one practical reality, there are many restaurants in Billerica that have outdoor seating that, here again, this would not be allowed, even though they're meeting CDC guidelines. And so I just didn't, if there was any comments or concerns based off of those points.
Well, I would like to say that I'm looking here, and Billerica just passed their executive order as well, and they're saying that restaurants and eateries will be limited to takeout, drive-through, or delivery. And I understand what Commissioner Chance is saying, and we are having to make some exceptions. And the water is going to be muddy to do what we can to keep the economy moving along, keep people on their jobs. But at every opportunity we have, such as restaurants, big gatherings, things like that, to kind of limit those things. And unfortunately, restaurants and anything of that nature is going to get hit hard because it's a social gathering, and they're going to get hit hard versus, you working at your job and that may be an essential thing that you have to do, or the employees are making an exception and trying to keep everybody apart. So we got to keep a distinction between a social gathering just because we want to do that for fun. Eating out is a thing that we do for fun a lot of times versus I got to go to work and make a living for my family. So we got to make those distinctions as much as possible right now. And the water is going to be muddy because this is unprecedented.
I think we have to make note that the social distancing works, and the sooner we implement these measures, the sooner that Carroll County citizens abide by them, the quicker this will be over, and the economic impact won't go on for months and months and months. So yes, it's going to be it's going to be bad for some businesses, for some families. I mean, we're all facing disappointments with proms being canceled, graduations, weddings. But I think if we all come together united and take extreme precautions now, we will not let this go on for months and months. So as detrimental it is to some, it could be worse if we do not start, and I'm not just talking about this as Board of Commissioners, but that Carroll County citizens start taking these warnings and measures to heart.
And Madam Chairman, this is Clint again. have you spoken with the sheriff, or do you have any idea about what enforcement in general would look like by us passing a resolution and depending on our different institutions that are connected with us to enforce?
Yes, I have been in contact, but I'm going to let Director Tim Paget with the EMA speak for that answer. Tim?
I shared the resolution from the Board of Health with the sheriff last night, and we discussed it, and, I think if we have to do anything, we'll be okay.
Tim, what is the enforcement? What is it? Is it a time? Locking people up? I mean, what's the enforcement?
Well, naturally, we don't want to do any locking up unless we have to, but, this is something that we'll all be working together on.
I think it will probably
We don't know
evolve.
what the enforcement or the penalties are gonna be. We don't know what that's gonna be yet.
Yeah, it'll be a case-by-case scenario.
Hopefully, we don't have to have our law enforcement get out. I'm really hoping that those listening and watching this video, and those of you as commissioners, as you continue to talk with your constituents, just please reiterate the importance of the social distancing, so that we don't have to resort to measures that none of us want to go with.
Madam Chairman,
Madam
I would like
Chairman.
Okay.
Go ahead, Clint.
This is my final question, Madam Chairman. So, obviously, you were able to, I guess, by the enabling legislation, you declared, Carroll County a state of emergency as the chairman, and you certainly had that authority. And now you're bringing this resolution to the full board. So, I guess I'm wanting to ask you, is this your intention moving forward, that if this was rescinded, if this needed to be modified, would you make a practice that you want to include the full board in the decisions moving forward, just like you're asking us now to come to enact this?
Yes, I will do everything as possible to involve each of you with time constraints. So there may be moments that I have to act based on the enabling legislation for the safety and well-being of all Carroll County citizens. But yes, today I have brought you to the table because I think it's very important for our Carroll County citizens to see that each of you that represent various parts of our county are on board, and to really get the message across that it's not just one person, but that is all 7 of us that would like to encourage the citizens of their district, myself, to encourage all the citizens of Carroll County.
Okay, thank you, ma'am.
Is there any other questions? If not, I would like to ask someone to call for the vote.
Are we still on? Can you still
Yes,
hear me?
I'm asking,
Yeah.
I had a motion and a second. We started the discussion and the questions, and if there are no further questions or discussion, I would like to ask someone to call for the vote, please.
I'll call for the vote.
Okay.
But
Is that
Commissioner McClellan
Montreal?
votes yes.
I'm sorry.
Are you ready for me?
Yeah. Yeah. Who called for the vote?
Morgan,
Okay. I'm sorry. I have a little confusion over here. Who called for the vote?
Montreal,
Okay. And then Susan, you're going to now call out each individual commissioner's name, and they're going to respond.
yes ma'am.
All right. Thank you.
We ready?
Yes.
Morgan,
Yes.
Chambers,
Yes.
McClendon,
Yes.
Chance,
Yes.
Lee,
Yes.
Fuller,
Yes.
Reynolds.
Yes.
That's approved by a vote of 7-0.
Great. Thank you very much, commissioners, and I'll be in touch.
Thank you.
I'd like to call for adjournment.
I make a motion to adjourn.
Second.
Second.
Okay. All right, good. Thank you very much. I have a motion and a second. All those in favor, say aye. Aye.
Aye.
Any opposed? All right, the meeting is now adjourned.